Hello, it's Phil.
Hi, it's Rachel.
So we're back again to talk now today. The topic is why taking pain medication tablets for your heel pain might not be a good idea. So do you see this happening, Rachel?
Yeah, so lots of my patients are referred by someone who may have suggested taking painkillers or anti-inflammatory medication to help with their heel pain. So it is quite common.
But you find that those people are coming to see us because they're still in pain.
And they're still in pain, yeah. So a lot of the time, the anti-inflammatory medication and painkillers can help deal with the symptoms and help relieve some pain, but a lot of them are finding that it only works for a short amount of time, and that pain, that foot pain and heel pain, is still lingering around.
Yeah, and sometimes in some cases I've found it can actually make it worse.
Yeah.
The main reason that we generally find that's the case is that if you have inflammation at the heel, all right, it's generally with the insertion where the plantar fascia joins on. So you can see this little piece here, all right. So the plantar fascia we've talked about in previous videos runs from the heel to the front of the foot. So if you're getting a foot that's collapsing a bit too much, or for other reasons there's too much tension or pressure on that area, every step you take is going to be making that condition worse. So if it's swollen, inflamed and sore, take some tablets, it may turn the pain down a few notches, and then you will go around and walk on it again and actually make it even worse. So Rachel, what would you say to a patient who has been taking medications, has had a bit of improvement in their pain, but they're coming and sit in the chair to talk to you again about their pain? What's the first thing that you usually look at when it comes to this condition?
Yeah, so first thing I look at is footwear is a huge thing.
Sure.
And how supported the foot is on a daily basis.
Yeah.
And whether or not there's excessive strain happening that may not need to happen.
For sure. So changing shoes will make a difference for some people?
It will make a huge difference.
Okay.
Yeah.
The second thing that I know I look for after footwear is generally what is the foot itself doing. So is the foot doing something weird that's actually going to increase the stress on that area? And if that is the case, medications, footwear, stretches, that sort of stuff, it's not going to be enough to actually prevent that injury from progressing and not getting better. So, Rachel, I know you're really fond of using shockwave therapy for heel pain. Yeah? So do you want to give like a little summary of what it is and when we use it?
Yeah, okay. So shockwave therapy is a really good treatment for tendon and ligament injuries. So plantar fasciitis or heel pain, it's an injury to the tendon that lies underneath your foot. Now, being a tendon, tendons don't have much blood flow to them naturally. So when we injure them, whether it's over time or whether it's in an injury that happens really quickly, your body takes a long time to heal it. So what the shockwave is basically it stimulates that healing, gets lots of blood flow happening, and it tends to heal up really quite well after that. Yeah,
it's fantastic treatment for this heel pain. And cost is a question our patients often ask, because they've obviously seen a few different people and they're saying, well, I want to get better, but I'm concerned about the cost, whether it's cost of actual visits to come and see us or the cost of putting something in the shoe. We crunched some numbers the other day just to look at actually what is the cost of treatment. So custom orthotics, for example. So if we were to make some really nice custom orthotics to support the foot and to prevent that excessive pronation and the tissue stress, if we spread that cost over the lifetime of the treatment, which could be 4 to 5 years, it's actually cheaper than taking 2 Panadol a day. So actually, instead of just masking the pain and actually making the injury worse, we can support the foot, let the foot heal, use treatments like shockwave to stimulate that healing process and get you back to normal so you can do the things you want to do. So hopefully we've convinced you that if you're having pain, and whether you're taking over-the-counter meds or whether your doctor's giving you some tablets, that possibly isn't the whole solution to your problem. And we are here with all sorts of treatments and techniques specifically for heel pain. That's one of our favourite things, isn't it, Rachel?
Sure is.
It is. So that's probably enough for today, but thank you for watching, and we'll talk again another day. Bye-bye.
Bye.